Well, I'm going to be telling you about the lipo laser and the clinical trial that we did using it and the studies that we did to try and determine how exactly it worked. I'll first talk about the methodology and describe the laser, and then describe the clinical trial and the other studies that we did, try to explain the mechanism of action and its application in practice, as well as concluding with a summary. A low-level laser therapy is called low-level because it doesn't heat the tissues more than 0.1 to 0.5 degrees centigrade if it heats the tissues at all. And the treatment energies vary from just a few joules per square centimeter with power less than 500 milliwatts. The low-energy lasers are considered therefore to be minimal risk devices, and they've been successfully used to relieve the pain and improve the healing of the carpal tunnel syndrome. The laser that we used was the Meridian Lapex 2000 lipo laser, which is a gallium aluminum arsenide semiconductor low energy laser, and it has two multi-probes that are housing 4 laser emitting diodes at a wavelength of between 630 and 680 nanometers. The typical treatment is 2 30-minute sessions per week, lasting 4 weeks, and often done during a person's lunch hour. This is a picture of the Meridian Lapex 2000 lipo laser. The clinical trial that we did enrolled 40 healthy men and women who were between 18 and 65 years of age that were not obese, meaning that their body mass index was less than 30, and they were randomized to have the low-level laser treatment to their waist 30 minutes twice a week for 4 weeks, or a placebo laser in which the device was actually turned off but couldn't be detected to be so, in a 1-to-1 ratio. And standardized waist measurements were made, standardized photographs were taken, and the photographer was blind to the treatment condition. The subjects were selected to have a stable weight and were asked not to change their diet or physical activity habits during the trial in an effort to keep their weight stable. The photographs were evaluated by blinded individuals who did not see the study participants, and the grading system was for no improvement was 0, for slight improvement was 1, 2 for moderate improvement, and 3 for marked improvement. The 2 multi-probes with 4 lasers each were placed around the waist and activated for 10 minutes at each spot, so that over the course of a half hour the entire waist was covered. And all but one subject finished the trial, and that patient was in the active treatment group, and it was due to scheduling conflicts and not due to any adverse events. In fact, there were no adverse events, and the subjects were well balanced in terms of their characteristics at baseline. The subjects lost about a half a centimeter in their waist girth at each treatment. For example, the third treatment, the subjects lost an average of 0.4 centimeters, which was a statistically significant reduction at the p equals 0.05 level or less. On week 4, at the end of treatment, there were 15 in the laser group who lost 2.15 centimeters in total girth, more than the 16 patients in the placebo group These were the patients, however, with a stable weight, and patients that gained or lost greater than 1.5 kilograms were not included in the analysis. This gives you an example of the what we've found. As you can see, the treatment 1, 3, and 8 all gave either close to or just slightly less than 1/2 centimeter in girth reduction. When this was analyzed after the first 3 treatments, you can see that those treatments were additive, and at the end of the trial, 0 to 8, there was a 2.15 centimeter girth reduction. The photographs showed us highly significant improvement in the ratings by the blinded reviewers. In fact, it's hard to see the placebo condition. The treatment condition is the blue bars, and if you look to the right of the treatment condition, you'll see a very small red bar that is indicating that there was a 0 for the placebo condition, and the average improvement was 1.2, which was between slight and moderate in terms of the intensity of the treatment, the change. Here's an example of one of the women who was treated. You can see that on the left-hand side was before treatment, and her appearance after the treatment, which shows some reduction in her waist circumference. And here's a man that was also part of the study, before the treatment and again after the treatment. So here's a picture using an electron scanning microscope to show what the fat cells look like. They look sort of like little grapes that are full. This shows what happens when the fat is treated for 4 minutes with a laser. As you can see, those full little fat cells are now look a bit deflated, and that's because the fat has been allowed to leak out of them. If one looks under the microscope, the electron microscope, one can see that the cell membrane is intact, that there's no holes through and through on the membrane. But if one looks at the cells after they were treated with the laser, one can see that there's actually a hole that's been, and the membrane of the cell is discontinuous in a spot, allowing the fat to leak out. And here you can see the picture of the cells before the laser treatment and then after radiation for 10 minutes in the presence of serum, in which the cells were releasing their triglycerides, but there was no evidence of the cells actually being destroyed. And so this cartoon shows what happens when fat is eaten. When fat is eaten, the fat, it goes into the intestinal tract and it's digested. It then gets broken down into fatty acids and glycerol. It then goes into the lymphatic system. It enters the venous system, and it can then either be burned for fuel or restored again as fat. When the person has their fat lasered, this takes a different course. So first of all, the patient has the laser treatment. The laser makes the small holes in the fat cells, and the fat leaks out of those fat cells, and it enters the lymphatics and then into the venous system. In the venous system, it gets broken down into triglycerides and to glycerol and free fatty acids, and then it's either stored again as fat or burned for fuel. There have been some other laser studies. In fact, there was an uncontrolled series of 689 patients who paid for the therapy in a private practice, and they were treated with low-level laser for cosmetic fat reduction. And the patients received 6 40-minute laser treatments over 2 weeks, and during that time they lost an average of 2.9 centimeters from their waist, 2.4 centimeters from their hip, and 1.5 centimeters from their thigh. In terms of how this can be applied in practice, men tend to distribute their fat in the abdominal area, and they're described as having central or apple-shaped obesity. Women can distribute fat like men can, and there are some women who have large abdomens and large breasts who are apple-shaped. There are also women who distribute their fat unlike men and concentrated on their hips and thighs, what's sometimes called pear-shaped. And when women with this lower body fat distribution lose weight, it seems to come first from their breasts. This shows a cartoon of how lipolysis happens. As you can see at the top of that fat cell, it is the beta receptor. That's what is activated and causes the analyte cyclase to create cyclic AMP in the cell. And it's sort of the second messenger that eventually activates a hormone called, an enzyme called hormone-sensitive lipase that breaks the fat into glycerol and fatty acids and releases it from the cell. But as you can see, the alpha-2 in yellow at the top of the cell is another receptor which inhibits the beta receptor and slows down this loss of fat. In women, estrogen increases the number of these alpha-2 receptors on the fat cells of their thighs, and therefore makes it harder for the fat to be broken down and released from their thighs. And this was noted in a book that was very popular back in the 70s called Cellulite, those lumps, bumps, and bulges you couldn't lose before, by a woman named Nicole Ronsard. And so cellulite was the term she used for the way that the fat looks on the thighs of these women. And the reason that it looks that way is because the fat cells under the skin have between them little pieces of connective tissue that connect the underside of the skin with the lower tissues. And the distended fat cells pull against those connective tissues and draw down on the skin from the underside and create sort of a ripply appearance to the top of the skin. And here you can see an example of that. Here's a woman that has that cellulite, and you can see those sort of lumpy, bumpy appearances to the fat of her thighs. So the laser works in the area where it's used. If the laser treatment is a cosmetic one, and without periodic treatment, it won't continue to keep the fat away from that area. It's sort of like if you want to have your lips red, you have to keep applying lipstick periodically. If one is losing weight at the time the laser is used, what it does is direct where that fat that you're losing will come from. However, if you're not losing weight, the fat will be mobilized and then it will be restored in fat cells in other parts of the body where that person's body normally stores fat. And there are potential health benefits that can result from the use of the laser, because when women with lower body type of obesity try to lose weight, as I mentioned earlier, the fat tends to go first away from their breasts, and because the fat is harder to mobilize from the thighs and hips. But because women with lower or pear-shaped obesity tend to have smaller breasts to begin with, they often want to actually have bigger ones, or at least retain the size of the breasts they already have. And sometimes this is distressing enough to them that they stop their weight loss program because they're losing weight in what they consider the wrong places. And this may even happen when there's medical reasons for them to want to lose weight. So the cosmetic advantages to the laser are that it causes the fat loss from the areas treated during a weight loss program, and encourages weight loss efforts in people who want to lose weight, particularly in some areas and not in others. And if the woman has cellulite, which some women feel is unattractive, the smoothing of the skin that occurs even before there's a significant girth loss is due to emptying out of the fat cells of their fat that are right under the skin and releasing the tension on the underlying connective tissue. And so body contouring is also possible by redistributing the fat without weight loss. So in summary, the low laser level laser therapy for cosmetic purposes is both safe and effective, and it mobilizes fat that can be metabolized during weight loss or stored elsewhere when people are not losing weight, and the loss of cellulite and directing the weight loss to the thighs and not to the upper body in women with lower body obesity can encourage healthy weight loss in those individuals who require it medically. Thank you.